Hello, my name is Nurse Pauline-RN. Today we're doing part 3 of stress adaptation, questions and answers from nclex-rn. Please hit the thumbs up so YouTube can present this video for viewing. Please subscribe. Please share this video. Our first question is, what sign and symptom would an anxious client experience? The correct answer is headaches, palpitations, inability to concentrate. Our next question is about interventions. What would be the interventions for a severely anxious client? Correct answer is sit with the client. Use calm but directive approach. Note, decision making in this client is impaired, necessitating direction from nurse until anxiety is decreased. Our next question, which is an intervention question, what would be your intervention for a client exhibiting tensions? The correct answer is client needs direction to solve problems. 2. Implement behavioral approach. 3. Encourage deep breathing exercise techniques. Our next question is about a patient who is in crisis. The question, what would be your care plan for patients experiencing crisis situation? 1. Establish a working relationship. 2. Discuss coping skills used in the past. 3. Assess if coping skills used in the past were effective. Our next question is about care plans for patients who are experiencing crisis. This question, how would you develop a plan of action for a patient dealing with future stressors? 1. Evaluate the developed plan effectiveness by using the nursing process. 2. Safety is priority. My next question is another intervention. Who are your clients who would require immediate intervention? 1. Clients experiencing rapid, pressured speech, poor personal boundaries. Prioritize safety. Monitor behavior closely to ensure individual safety and make sure milieu remains safe. Another question, what is crisis? Correct answer, 1. Crisis is precipitated by specific individual event. 2. Crisis is specific to an individual and cause of crisis may vary. 3. A crisis contains the potential for psychological growth or psychological deterioration. Next question, what crisis of life transition exhibits anxiety? The correct answer, number 1, example, failure in school. 2, lack of control over events. 3, events presently occurring can further complicate life-changing events. Our next question. In group therapy, a client has increased restlessness, irritable, shouting out. What would your priority nursing diagnosis be? The correct answer: 1. Risk for violence to others related to inability to deal with frustrations. 2. Safety is always priority according to Maslow's hierarchy of needs. 3. Client may also be in prodromal state of crisis and may present an immediate threat. Our next question. A nurse is floating to the psych inpatient floor, or a nurse may be coming from the agency on the outside, not familiar with the hospital. Which patient should these nurses be assigned to? We spoke about this in my previous video. The correct answer is a newly admitted patient diagnosed with suicidal ideation with a plan to commit suicide. These patients should not be assigned to a nurse, for example, from a medical med-surg floor or an agency nurse. Please note, when clients have suicidal ideations, a plan to commit suicide, the nurse should monitor vital signs every 15 minutes. Please note, if your client becomes extremely ill, this client would not have access or means to carry out the suicide. Next question. Clients with major depression with nursing diagnosis, I'll repeat this. Clients with major depression with nursing diagnosis, social isolation. What would exhibit a positive outcome? Your answer is client would attend group meetings. Client would communicate with staff. These are improved socialization skills. Client attending group meetings, client attending group therapy, client communicating with staff. These are positive measures for clients with major depression, nursing diagnosis, social isolation. These would be positive outcomes for patients to start socializing, talking to people, and not isolating themselves. Improve socialization skills. Okay, this is the end of part 3. Part 4 will be next. We will be talking about defense mechanisms. Have a good day. Please hit the thumbs up. Please subscribe. Please share my videos. Have a good evening. This ends part 3. Thank you.